Hello, everyone. Um
Uh, One sec, doctor. Welcome to today's session on fever in children by Apollo Cradle and Children's Hospital. To speak on the topic, we would like to welcome Dr. Avneet Kaur, who is an in-house consultant in pediatrics and neonatology. She has done her MBBS, DCH, DNB, FAGE. We welcome you, doctor. You can now take over the session. Thank you.
hello, everyone. I'm Dr. Avneet Kaur, and I'm a consultant neonatologist and pediatrician at Apollo Cradle, Moti Nagar. And today, I want to discuss with everyone the hot topic, which I think everybody must have faced this challenge in last 2 years, that is fever in children. So, as all parents and as colleagues, my friends, everybody, we all talk like, the parents are really hassled, and there is something which has come up in everybody's mind, which is fever phobia. So we all need to understand that what fever is and how we can manage this fever at home, and what are the danger signs where we need to take up this fever details with our pediatrician or our doctor, and what exactly is fever. So let me first start off with that fever is not a phobia. Okay, fever is our body's immune response to anything which is happening in the body, which tells us that our immune system is working good. So, fever is mounted by our body as in response to any illness, any infection, so that the environment inside our body becomes hostile for that infection. So, we should not be afraid of fever. Fever can be mild, moderate, severe. Irrespective of that, the fever is not something to be really afraid of. So, first, let's talk about that why fever happens with all of us. So, we need to understand that our body has an organ which is called as hypothalamus. Hypothalamus is thermostat of our body. So, the moment any infection or any illness comes inside our body, the thermostat suddenly raises the temperature of the body so that the environment inside the body becomes hostile for that infection to grow up. So, we start mounting fever. Now, is every fever harmful? Or what do we do with this fever? What do we do whenever the fever is coming? So, first we need to understand that what is the normal temperature. So, any child who is less than 2 years of age, so they have their normal body temperature, which is slightly more than the temperature of a child who is more than 2 years of age. So, our normal body temperature is considered to be more when it is more than 98.4 or 37.5. So this is something which is beyond the normal. But the terminology of fever is used when the temperature is going more than 100. So that is the term we use when it is fever. So is this that every fever should be like considered that we should immediately approach the doctor? So, in some scenarios, yes, we should immediately try to approach the doctor, or otherwise, we should start giving some home therapies to the child. Okay. So, whenever the child starts coming up with the fever, we should first try to see how much is the temperature. Normal, our routine, this thing is that we try to take the hand and we check the baby and we feel baby garam lag raha hai. So that is not the accurate way. It can just give you an assessment, there is something which is going wrong. But the right way of assessing any fever is to check it with the thermometer. Now, the checking with the thermometer, as we know that there can be various types of options available of the thermometers. So we have thermometers which are digital thermometers. We have thermometers which are mercury thermometers. We have thermometers which check the temperature at the temporal, which is temporal artery thermometers. We have thermometers which are eardrum thermometers. And we have, in present era with the COVID times, we have seen there are infrared thermometers which have come up. So if we take the temperature of any child with a thermometer, which is the digital thermometer, and we get that the temperature of this child is coming more than 100.4 in the oral cavity, then we call it as fever. Okay, if a child who is less than 3 months of age, is the temperature more than 100, is the fever. Child between 3 months to 3 years of age, anything which is more than 100 is called fever. Now, when we take the temperature with our digital thermometer, or when we take the temperature with our infrared thermometer, so if we take it in the axilla, any temperature more than 99 is considered to be significant. When we take the temperature in the oral cavity, anything more than 100 is considered to be fever. If we take the rectal temperature, anything more than 100.4 is considered to be fever. So this is how first we have to assess that like, is the baby having fever or not. So once we have assessed that the baby is having fever, so we can start with the medications like paracetamol, or if the fever is going high, your pediatrician or your doctor must have prescribed sometime mefenamic acid or sometime ibuprofen. So based on your pediatrician or the advice given by your pediatrician, there are some fever medications which you can start the baby on the regular basis without even asking the doctor, so that the temperature does not go very high. So in what scenarios you should consider taking the approach that you should consult your doctor, or you should teleconsult or meet your doctor? So whenever a child is having fever, if the child is having any fast breathing, if the baby's breathing is fast in spite the fever has come down and the baby's breathing is turning to be fast, or if the baby is too lethargic and the baby is not accepting orally, and not accepting orally means that the baby is not urinating, so less amount of urine, that means the child can go in for dehydration. Okay. Number 3, if the baby is very irritable, very very cranky, or if the baby is having severe pain in the ear, or if the baby is having severe pain in the abdomen. Okay. So if those emergency signs are shown up by the baby, you should consult your pediatrician. Now, the fever can be just a sign of any viral illness, it can be bacterial illness, it can be some chronic illness. So, most of the time, as pediatrician, if there are no danger signs in your baby, we advise you that you should wait for 48 72 hours at home by giving home treatment to your child. If your baby is otherwise taking fluids well, baby is urinating well, baby is breathing well, and the baby is not going in for any dehydration. So, as an initial plan, we should have some home care plan for the baby who's coming up with fever. So, what is the home care plan for a baby who's coming up with fever? Number 1, if the fever is going above 100, we should start the normal medication like paracetamol, and we should try to give paracetamol every 4 to 6 hourly. Number 2, we should go up with higher with the medication also only after consulting with the doctor and not self medicating the child. Number 3, we should ensure that even though we know with the fever, the commonest symptom of the child will be that the child will start not accepting orally the normal feed which the child used to take. So, the most important thing we want is to keep the child hydrated. We want at least 4 to 6 urination with the child. So, if the baby is not taking anything orally, we should try to give some liquids to the child, maybe in form of coconut water, maybe in form of lassi, maybe in form of buttermilk, maybe in form of some milk, or maybe in form of some fresh homemade juices or soups. Commonly, the parents ask me, मैम बच्चे को तो ठंड लग जाएगी अगर हम उसको कोकोनट वाटर दे देंगे, या मैम हम उसको अगर हम घर का बना हुआ फ्रेश जूस दे देंगे. No, the aim is to keep the child hydrated. Even if the child is have cough cold, don't mind keeping the child hydrated by giving these fluids. Next common question which is asked to me by the parents is that क्या हम बच्चे को नहला सकते हैं? Yes, आपने अपने daily routines जो आपके बच्चे के लिए करने हैं वो that you all have to do, because that will make your child feel fresh. Okay, so नहलाना, बच्चे को hydrated रखना, these are very important things which needs to be done for your child. When the baby is turning high grade fever, so most of the us will do this, that we will put more blankets or we will put more clothes on the child so that बच्चे को ठंड ना लग जाए. ठीक है, but we need to undress the baby, we need to loosen out the clothes for the baby, we need to remove those blankets, because agar if the room temperature is too high, then the fever will not come down for your baby. So hydration, loosening the clothes, making the ambient temperature so comfortable that the heat dissipates out of the body of the baby is what we need to do immediately for that baby. Now, also you need to understand that commonly bache they stop eating. That's their major symptoms which they manifest when they are troubled with some illness. Yes, we know they are not going to eat, so we have to be patient with them. We have to be relaxed. We have to be relaxed with the child. Let ये नहीं है, if the baby is unwell, baby is having fever, तो उसको हमें हमेशा उसको bed rest पे रखना है. Baby, let the baby do the normal activity. Normal activity will not raise the body temperature of your child. Okay, so keeping the child hydrated. If the baby wants to eat, let the baby eat. If the baby is not eating, but still give good hydration to your baby. And medication as prescribed by your pediatrician, paracetamol, and let the baby's temperature come down with every 4 to 6 hours of paracetamol, and go higher up on medication only and only if required. So this is the home care plan for any baby who is coming up with fever. Now, is every fever need to be treated? No, only if the fever is going above 100 and the child is becoming uncomfortable. Okay, that is when we tell you to give medication to your child. Okay, now yes, we all say that ज़्यादा दवाई देंगे तो बच्चे को side effects होंगे, बच्चे ने कुछ खाया भी नहीं हुआ. This is again the commonest question which is asked. So you need to understand that paracetamol is considered to be a safe medication. So we advise you to give paracetamol 4 to 6 hours interval if the temperature, if you feel there is really a fever and which is troubling your child. Now, is it that we should leave the fever? We should not treat the fever. So any child who's between 6 months to 5 years of age, if the temperature suddenly rises above, the child can come up with something which is called as febrile convulsion. So we should treat this fever to get the fever down below 100 so that the child does not come up or throw up with fever, throw up fits with the fever. Now, very importantly, I also want to inform you that child who is less than 3 months of age, who is coming up with fever, should definitely be consulted with your pediatrician, either by teleconsult or physical consult, because in children less than 3 months, usually they do not mount fever until unless there is a significant infection in the body. So it is very important that this fever should be addressed by your pediatrician and should be consulted with your pediatrician. And you should also know the danger signs in these babies of fever, that they can suddenly come up with fits, they can suddenly come up with brain infections, they can suddenly come up with infections spread to the whole body. So that is why this category of children, they should be immediately addressed for their fever with the pediatrician. There's another common entity which is commonly discussed in my outpatient practice, that हमें पता है फीवर बच्चे को इसलिए आ रहा है क्योंकि उसके दांत निकल रहे हैं. So teething is one of the most important factor which is addressed by most of the parents as a cause of fever. So we all need to understand that while teething, there is some bit increase in the body temperature of the child, but not to the extent that it can cause fever to the baby. And in most of the times, during the teething time, the child is little irritable, the child has little irritation on the gums. So that is why they are trying to put things to the mouth. And during this while, their immunity is also at a little lesser level. So they pick up infections which are most commonly viral infections faster. And in view of those viral infections, they come up with fever. So it is not the teething per se which is causing them fever, but it is the viral infections which is causing them increase in the temperature, which should be addressed with your pediatrician, that why the temperature is coming with the baby. Now, what is the scenarios where you should take up the child in emergency into the hospital emergency, where you should not wait with the fever coming? So if the child is extremely irritable, and even after getting the fever down, the child is unconsolable and where extreme irritability is persisting. If the child is too lethargic and the child is not the child is not waking up also in spite of your regular stimuli, or if the child is having rashes all over the body or some bluish patches in the body, that suggests you should see the doctor immediately in the emergency. If the child has fast breathing or there are some blue lips, or if you find that the soft spot which is on the head of the baby is bulging or it is depressed or sunken, if the child has a stiff neck, or if the child is having seizures, convulsions, or if the child is going in for severe dehydration, that is, the baby is not passing urine, and or if the baby is breathing very fast and the child is breathless even in spite of the temperature coming down. So these are the emergency situation where you should not wait and you should seek the emergency help of your pediatrician. Now, as you understand that fever is something which your child will definitely, once in a while, the child will come up with fever, which cannot be stopped, because the children less than 3 years are prone for some or other viral infections. That's how they build up their immunity. So, less than 3 months old child having any symptoms of fever should definitely be consulted with your pediatrician as early as possible. Any child who's more than 3 months of age and otherwise the child is doing well, the child is urinating, the child is accepting feeds, the child becomes fine and active after the fever comes down, just try to wait for 48 hours. See if the child is coming up with any symptoms or if the fever is persisting. So, if the child is 3 months to 2 years of age and the fever is like more than 48 hours, you should seek your pediatrician's opinion. And if the child is more than 2 years of age and the fever is persisting beyond 72 hours and otherwise the child is not well, then you should seek the pediatrician's opinion. So, in nutshell, I want to convey that every fever is not something which we should develop a phobia about. There is a lot of things which we can manage about the fever by giving some home care to the baby. And most of the viral fevers get sorted in 48 to 72 hours. However, if there are danger signs, if the child is not doing well, or if the fever is not being managed by you, or if there are some signs which requires urgent warrant for your pediatrician to see, that is when you should seek the opinion from your pediatrician. So, fever should not be taken as something which is this disease. Fever is not a disease. Fever is a symptom of a disease. And as the disease gets sorted, the fever gets sorted. Okay. So, I hope I must have relieved couple of these myths about the fever, which is in minds of a lot of parents. If there are any queries, you can consult with me in the chat options. Thank you so much. So there are some questions which have been raised. Is what is the reason for frequent fever in children? So there are some medical illnesses which can cause frequent fever in child. Like there is illness like typhoid. They can be urinary infections. There can be some immune disorders in children which can lead to frequent fevers. However, in our environment, you need to understand there are trillions of viruses, and most commonly our children in first 3 years acquire a lot of viral infections, especially when they go to schools, they're going to daycares, so they pick up frequent infections. The most common reason of acquiring frequent infections is viral, but still if the fevers are not resolving, or the fevers are something which needs which is affecting the daily well-being of the child due to recurrence, you should seek your pediatrician opinion, and if warranted they will go ahead with some other investigations for your child. Is medicine necessary to lower the fever, and what are the side effects of such medications? I had already prescribed you about this, that we do need medications if the child is being troubled, or if the temperature is in the fever range, because they can come up with seizures in the children range of 6 months to 5 years of age. The common side effects of the medication, especially like paracetamol, is considered to be one of the safest medicines. However, in like too much doses or wrong dosages, or like too long duration of paracetamol can have some impact on the liver of the child. And other medications like mefenamic acid or ibuprofen should be taken only on prescription with your pediatrician. Padma, are there any other questions?
That's all, doctor. We can end the session. Thank you. Thank you so much. Thank you.